Hi there guys, welcome to today's live stream. We're going to be talking all about piriformis syndrome, giving you guys a bit of a better understanding about it. We've also got some exciting announcements. If you're part of the Back in Shape premium membership, then we're going to be releasing a new video for phase 3 later today. So make sure you head over to your membership site or the Facebook group to check that out. I've got some additional information there. And as always, if you find these live streams helpful, then please do consider liking, subscribing, sharing them with anyone that may also benefit from it. And then today, at the end, as always, we're going to be doing a live Q&A. So if you've got any questions about your back pain, about your piriformis syndrome, then please do put those in the comments, as Lara's behind the computer, so she'll be able to read those out to me. And while you're watching this, if you've been diagnosed with piriformis syndrome or had it in the past, tell us what treatment you've had. Put that in the comments. Has it worked? Has it helped you? And were you convinced with that piriformis syndrome diagnosis? So today we're going to talk a little bit about sort of piriformis syndrome, what it's supposed to be. I'll touch very briefly on sort of the general my general vibe from some of the literature on this, and then really what you can do about it if you are suffering with piriformis syndrome. So the first and most important thing to note is that the research around piriformis syndrome, unlike other injuries, is really rather sketchy. It's not necessarily so consistent. There's a little bit of contradiction around there. And when I sort of start going through piriformis syndrome in terms of what it is and what symptoms you might have as a result of it, I think you guys will start to understand that maybe this isn't the right diagnosis for me, because it kind of just doesn't really make sense. And if we're going in there and trying to hammer this tiny little muscle, as you'll see later on, we're not really going to get too far, because in my opinion, spoiler alert, it's not really the main problem when it comes to actually the cause of your symptoms. So I thought I'd start off. We've got a nice little diagram here that's going to show you guys the piriformis syndrome, and this really is the butt of the joke. Excuse the pun. Essentially, on this screen here, you can see just above me here, the red line there is pointing to the piriformis muscle. Now, it's one of 6 lateral hip rotators that act on your hip joint. They pull it in, they pull the foot out, so to speak. So you're sort of waddling like a penguin. And then it runs right underneath. You'll see the glute max on the left hip as you're watching it. Sorry, the one on this side. You'll see it runs right underneath the glute max, as do the others. So the main notion with piriformis syndrome is that you've been diagnosed for some reason that particular little muscle, and it's only ever that muscle. It's never the gemelli or the obturator muscles, which are the other lateral hip rotators. It's only piriformis has become injured, and that is then going into spasm and causing your sciatic pain. And for some reason, that little one has become injured, as opposed to the glutes or the other muscles. In a lot of cases, it's someone that's not necessarily that active. Maybe you do sort of a regular bit of gym, but you can't say, I fell on a bollard and it hit straight onto that muscle. That would make sense, a blunt force trauma to the area. But then really, you're going to have lots of other issues associated with that. So piriformis syndrome quite often is just a diagnosis of really, oh, well, we can't figure out what else is wrong with you. So it hurts here when we press on your buttocks, which for most people, it kind of does a bit anyway. And we'll go with piriformis syndrome as a diagnosis, and it's irritating your sciatic nerve. Now, you'll see there's a little white space just underneath that piriformis muscle on the screen, and that's where the sciatic nerve runs through. Now, in some cases, it runs through the layers of piriformis, but fundamentally, the diagnosis of piriformis syndrome is that the muscle is injured and spasming for really no apparent reason. We don't really know why. And here's the real kicker when it comes to piriformis syndrome, is that the symptoms are similar to a lumbogenic problem, in so much as you will get symptoms that are the same as if you've had a lower back problem. Maybe it's a lumbar stenosis as a result of a disc bulge, or some facet changes, or spondylolisthesis, or some degenerative changes. And I'm throwing a lot of terms out there to you that you might see on an MRI report. But essentially, they're saying that the symptoms are more or less textbook exactly the same as if you had a problem here. Now, the piriformis syndrome, as you saw in the example, runs through here. And what happens is, we all know that when we have an injury to the spine, be it and it results in sciatic type symptoms, that you're going to get some spasm in the glutes because they're controlled by this section. You're going to get some spasm in the hamstrings because they're also controlled by that same section. And you might get some symptoms down into the foot because that is also controlled by that same section that's affected. when we injure the lower lumbar spine. And we're talking predominantly the L5-S1 segment, and that can impact what's called the L5 nerve root and also the S1 nerve root in particular. Well, you know what else is controlled by that particular segment? The piriformis syndrome, the piriformis muscle, as are all of the other lateral hip rotators. So when it comes to piriformis syndrome as a diagnosis, it really is more likely that you have spasm in that region, the glutes, the piriformis, the other lateral hip rotators, the other glutes, because you have an injury in the lower back. So going and hammering into the piriformis, maybe we're doing acupuncture or we're doing soft tissue inhibition or injections, really isn't getting to the crux of the problem unless you otherwise have a perfect lumbar spine and a clear mode of trauma that has caused a direct impact to that particular part of the body. Then you're not really going to have randomly injured the piriformis muscle. Now, some people might say, oh, well, this is comparative to the supraspinatus in the shoulder, which is one of the tendons in the shoulder, which runs underneath the deltoid muscles and also is supported by other external rotators of the shoulder. Why is it that if the supraspinatus tendon can be injured and it's well documented, why can't the piriformis in isolation? Well, the simple answer to that is there are some peculiarities with regards to the vascularization, which is the blood supply of the supraspinatus, which makes it particularly vulnerable. And we won't get into that in this video, but if you guys are interested in us talking about why supraspinatus in the shoulder is so vulnerable and how that differs to something like piriformis syndrome, and why just because one can be injured doesn't mean an isolated muscle can be injured in the hip, we can talk about that in another video. So please do, if you're interested in that for the shoulder, then please do post that in the comments and we'll look to get a video on one of the other live streams coming up on that particular topic. But coming back to piriformis syndrome itself, fundamentally, it doesn't really make much sense. If you haven't excluded the lumbar spine as being a problem, examine the lumbar spine effectively. If the lumbar spine is otherwise perfect and we have a clear blunt trauma to the piriformis region, then you're likely to have a lot of bruising in that area and a lot of other issues. So when it comes to piriformis syndrome, really not convinced, but I'll leave that up to you guys. Now, if you've got any questions as we're going through this, then please do post those in the comments and Laura will read those out to us. But that is essentially it. Now, when it comes to treating piriformis syndrome, you need to treat it as a lumbar spine issue. What are we going to do there? Well, if you've watched any of our recent live streams, this is number 46 that we've been doing through the lockdown period, well on our way to number 50, so it's been really good. But we've talked about this a lot in these live streams. We've put together our Back in Shape protocol, which will help you get out of pain immediately. So that's more for sort of relief-based exercises, and then that's the phase 1. And then you've got phase 2 and phase 3, which I mentioned at the very start of this video about some new content that's coming out for that, which will help you build up the strength and stability. But what we need to do is treat the lumbar spine. We need to get in here, reduce some of the inflammation that's happening around here in this lower back, because it can commonly refer pain over to this region. So we want to use icing over this region. We want to strengthen up these muscles. If you are concerned that there is a lot of spasm in this region, we may not want to be too aggressive with the hip stretching. So we're limiting that to 30 to 60 seconds a couple of times on each leg and doing it symmetrically 3 times a day as per the protocols. But we want to keep the hips mobile so that the spasm that may well be occurring, because we don't dispute with piriformis syndrome, there's not spasm in the piriformis. What we're disputing here is the cause of that spasm. And I'm saying to you that it's much more likely that it's something is wrong and faulty here that is constantly aggravating the piriformis and the other muscles in this region because they're getting inappropriate signals. So we want to keep that as flexible as possible. And we want to do that lumbar decompression stretch, which is going to take pressure directly off those lower lumbar segments, the discs down here, and the other structures like the facet joints as well. So that's what we want to do in the short term. And that's to provide relief, that's to take pressure off injured tissues and really help start your body along that healing process. Beyond that, if there is an element of spasm in the piriformis, it's working extra hard, as will the other lateral hip rotators be, then we want to also go through that strengthening process. So that is to say, building up the core muscles above those hip muscles, and then building up the glutes, etc., the hip muscles, the leg muscles, through a robust strengthening protocol. And that's what we talk about in the phase 2, slowly feeding in this sort of ever-increasing strengthening exercises to build up those muscles so they are more durable in the future and can protect your lower spine, your lumbar spine, for the long term. So that's pretty much it. Just to round it all off before we get into Q&A, Fundamentally, as we saw earlier, the piriformis is one of many muscles in that area, and we only separate these muscles out more so for academic purposes rather than reality, because in reality they do blend together in a big way, and they are very difficult in some respects to delineate. They all function very in a very intertwined manner. So to injure one small muscle, and you can see it there, to injure one tiny muscle is highly unlikely. And then knowing that there is a muscular issue, we then need to get back to the actual cause of the problem, which is in the lumbar spine at the top here. And by effectively treating the lumbar spine through the protocols that we discussed time and time again, those at-home protocols if you can't see a practitioner at the moment in the Back in Shape membership, by treating this area here, we can reduce the signals that are going to the piriformis and other muscles in this region so that the body can start to return to a normal state of function, and then moving on to do the appropriate rehabilitation exercises to strengthen and protect your lower back and the surrounding pelvis for the long term. That's pretty much it for me today. Let's go into Q&A.
So Ollie has asked, is it possible that if the sciatic nerve runs through the piriformis muscle in a person, they are more likely to get sciatic?
So muscles, if the sciatic nerve is running through the piriformis syndrome, are they more likely to get sciatic pain? I suppose they are. If they were to have a lower back injury and it was to irritate and send signals to those glute muscles, and by glute I mean the muscles of the gluteal region, which would include piriformis. So if we were to injure the lower back and you were to get referral in those glutes, if you had the anatomical variation where it goes through the piriformis, pierces the piriformis muscle, arguably yes. If the piriformis is constantly contracting, it's more likely to give you the symptoms going down the leg from a rational standpoint if those muscles are tightening up. But I would also argue that when a muscle contracts, it gets bigger, it moves up, or it expands. And what's to say that the piriformis above with the muscle below, when they contract, they're not going to press on it just the same? So is it really going to make that much difference? In reality, if all of those muscles are tightening up, they're going to restrict the blood circulation. They're going to have the propensity to put pressure on those nerves. And is that really going to be that much different whether or not the sciatic nerve pierces it?
Okay, Karen has asked, are there any particular exercises that might make spasm worse in the piriformis?
So I think yes is the answer to that. So the question there was, are there any exercises you could do that would make it worse? And the short answer is yes, those sorts of knee hugs. The classic piriformis stretch, unfortunately, is not very good. It's where you're lying on your back, you've got one knee crossed over the other, and then you hug the knee towards your chest. Many of you will have done this or been prescribed this, or even if you sat on the floor leaning forwards with one leg bent, you'll know if you've done this exercise before. But all of those piriformis stretches tend to involve a good degree of rounding of the lumbar spine. And if you've seen any of our videos, you know that rounding of the lumbar spine, flattening of that lordosis, is going to put further pressure on those lower lumbar discs, on those lower lumbar structures that are trying to heal. And therefore, although you may well be stretching that muscle in the short term, you're going to make the problem worse, which means that afterwards you're going to get those increased signals to those muscles telling them to tighten back up again. The secondary problem, and I've seen this in patients, is where the problem is managed so badly and people are yanking everything so much that this muscle never gets a chance to actually recover and rest. And I mean the muscles in general. And then what you start to get is around the bony bits along here, you might even have this yourself, where they plug into the iliac crest and then onto the sacrum, starts to become very tender. And that's called periosteal pull. That's where the attachment site of the glutes and those other muscles start to pull on the bony surface and create inflammation there. So you're creating secondary problems because there's that sometimes frustration. Many of you watching this, if you've had lower back pain for a long period of time or piriformis syndrome, there's that willingness, you want to get better. So you'll be given a stretch and you assume it's the right thing and you just yank it as hard as you can to try and get the stretch out because the muscle's tight all the time. But you're fighting the wrong battle, and that can make symptoms become worse. And then you do have a piriformis problem, or you've got a musculotendinous junction or a tendino-osseous junction, basically muscle to tendon, tendon to bone, because you've treated it really badly.
Okay. Should I ask a friend or a family member to massage the area by digging their elbow in and trying to get the muscle to relax that way?
Yeah. So I'm not a big fan of that sort of massage approach when it comes to lower back pain. A healthy individual, an athlete, someone like that who's fit, healthy, strong, got a good body, they work out regularly, will really benefit from massage-based work. But if you please do this at home, providing you're not a vegetarian, grab a chicken breast in the kitchen, put it on the kitchen table and get your elbow and just dig it into that chicken breast and have a look if that chicken breast looks good or bad after you've put your whole body weight through it. I think you'll decide whether you think that's an appropriate scenario or not. Again, spoiler alert, it's not. You basically are causing tissue damage. And if we've got a muscle that is being constantly asked more of it because of a lower back issue, getting your elbow and just jamming it straight in there is really going to create potential issues in the healing process because you don't have a normal mechanisms functioning in that lower back region because we already have an injury somewhere else. Now we've got two injuries, and one is, yes, more acute, but the natural healing process will potentially be disrupted in that region for a number of reasons. Number one, you've got a lower back problem, which means you're getting inappropriate signals to the area that you just used your elbow on. And number two, those muscles are probably working inappropriately, so they're not going to necessarily get the nutrients they need to recover effectively. As I said, for a healthy person who's a fit and healthy individual, looking at some of that work to improve their recovery times for maybe running or gym work or athletic performance, then it is going to be appropriate. And there are many techniques and people that specialize in those sorts of things which work well. But if you've got a chronic back problem, doing that, I think, is one way to really make it worse, even though it may well feel pleasant in the short term because it releases endorphins.
Okay, so the glute stretch is similar to the knee hug. What is it that makes the knee hug aggravate compared to the glute stretch?
So if by the glute stretch they mean the piriformis stretch where you put one knee over the other, they do exactly the same. I mean, the glute stretch is or the piriformis stretch that you do where you pop the one knee over and then you hug it to your chest. Yes, it's stretching the glute, but the motion that happens in the lumbar spine is that. And that flexion, as you guys can see, it really squashes down on this lower lumbar disc. So although you're stretching a muscle and there's that difference, the effect on the lumbar spine is the same in so much as the exercise, whenever we talk about, and if you're in the Back in Shape membership site, you'll see this on the videos, even in the phase one. When we're talking about stretching hip muscles, we want to stretch the hip only. And my big gripe with a lot of people that do stretching at home, which is why it doesn't work for them, is that then there is not a specified approach. I want to affect the hip joint, and therefore I'm only going to move the hip joint. Unfortunately, too many times, which is why people get in trouble, they're not just stretching the hip joint, they're stretching everything. So the lower back gets involved, the lower back bends forwards. That creates a worsening of the lower lumbar condition, and then the symptoms get worse. So your hips hurt more, so you do more stretching, so you make your back worse, so your hips hurts more, and you can see how it goes on and on and on because we're not specific. And that's one of the failings in a lot of the YouTube stuff. That's why we put together the Back in Shape protocols in the first place, where we've got a longer video that you can watch on how to do these particular stretches, how you can progress, why you're progressing like this. And one thing we do notice from time to time, because we can see, going off on a bit of a tangent, inside the membership area, we can see what videos people watch and what videos people skip. And all too often, people skip the information videos and jump straight to the exercise videos, and then they're not paying attention to the things that we covered in the information videos, which is why it doesn't work. So you have to follow the process, understand things. People just want a very, very quick answer, and the videos aren't long in the information section, but they give you those underlying principles so that you stop making yourself worse when you're doing exercises. Because people come to us all the time, they say, I've done hamstring stretches before, and then we give them the way we tell them to do it, and they work. And it's because there's just that care given to the exercise or the activity or the stretch to make sure that it is effective and focused to the joints and the muscles that we want to affect, whilst not impacting those that we want to leave alone. Any other questions?
No, that's okay.
Awesome. Well, I hope you guys did find this video helpful on piriformis syndrome. Not a big fan of it, as you can probably tell by this point in the video, but as I said, let us know in the comments if you've been diagnosed with piriformis syndrome, if you've had injections, if you've had other therapies, if they've worked, if they haven't worked. And we'll do our best to engage with you guys in the comment section, because it's always interesting to see what other people have had and how it has or hasn't helped. If you're a member of the Back in Shape, especially if you're a member of the premium, then check out, we're going to be uploading later today, stroke tomorrow morning. We're going to be uploading a new video for phase 3. And as always, thanks so much for joining us on today's live stream. It's really, really helpful for us. It's really helpful for you guys when you're asking questions as well. So that is much appreciated because it gives more value to everyone else watching this. So thank you. And if you do find these videos helpful, please do consider sharing them with other people. Consider subscribing to the channel if you haven't already. And with that being said,
enjoy the sunshine.
Enjoy the sunshine today on this bank holiday. If you're watching this live stream right now, and if you're not, well, hope it's great wherever you are. Thanks for watching. Have a great week ahead.